What is morphine? Morphine is a strong opioid analgesic used to relieve severe pain. It works on the central nervous system and is often used when other painkillers do not work. 2. Classification class, opioid analgesic schedule, controlled substance, high risk of dependence, source, naturally obtained from opium poppy, Papaver somnifera. 3. Mechanism of action, how it works, morphine binds to mu-opioid receptors in the brain, spinal cord, and GI tract, effects, blocks transmission of pain signals, increases pain tolerance, produces sedation and euphoria, depresses respiratory center, can cause respiratory depression. 4. Uses, indications, morphine is used for severe acute pain, postoperative pain, cancer pain, myocardial infarction, to reduce pain and anxiety, trauma-related pain, palliative care. 5. Dosage, general, note, exact dose depends on patient condition, tablets, 10 to 30 milligrams every 4 hours, immediate release, extended release, 15 to 200 milligrams every 12 to 24 hours, injection, 4/IM/SC 2 to 10 milligrams every 2 to 4 hours, oral solution, 10 mg/5 ml. 6. Side effects common, drowsiness, constipation, nausea, vomiting, itching, dizziness, serious, respiratory depression, low blood pressure, dependence and addiction, withdrawal symptoms, pinpoint pupils. 7. Contraindications, avoid in breathing disorders, asthma, COPD, severe head injury, paralytic ileus, allergy to opioids, liver or kidney failure, use cautiously. 8. Precautions, risk of addiction and overdose, do not mix with alcohol or CNS depressants, avoid driving, monitor respiratory rate. 9. Pharmacology summary, absorption, good oral absorption, distribution, widely distributed, crosses BBB, metabolism, liver, glucuronidation, excretion, kidneys, half-life, 2 to 4 hours. 10. Forms available, tablets, capsule, syrup, injectable, 4/IM/SC, suppositories, extended release tablets.